Hello friends, welcome back. In today's video, we are going to discuss about the analysis of the case and remedy given to this patient. So in last video, we saw this was the case, 25 years old man having the rheumatoid arthritis, pain in knees going up to thighs, pain in neck going upwards, right? So these are the modalities. So in last video, we discussed the case, the modalities, the symptom, the character of pain. So today we are going to discuss about the analysis of the case. So when we try to analyze the case, what I understood. So the location, what he is saying is very characteristic. And the pain, the character of pain is also very characteristic. So we can see the PQRS at the local level. So when you see what is the location? So the location is muscle bellies. What he is saying, whenever I get the pain shoots up from the knee up to the thigh, and maximum pain is in thigh, in thighs, in the muscle of thighs. In the neck also, pain is in the neck going upwards, but the maximum pain, what he said, I feel in my muscles, neck muscles, cervical area muscle. So what I thought, the known case of rheumatoid arthritis, yes, it is there, but the pain, what is showing, he feeling more pain, maximum pain in the muscle bellies. And this is the exact location I want in my remedy. And it has to be a rheumatic remedy also. And then how is the character of pain? Electric shock like shooting pain, and which is going upwards. Okay. So this kind of pain and muscle belly location. So these are the two most characteristic symptoms in the case. If you see the modality, beginning to move, aggravation, right? And when you walk, then pain goes down, is very common in rheumatoid arthritis. Please always remember. Then he is getting aggravated in winter season, cold weather, rainy, cold, cloudy weather. This is also very common in rheumatoid arthritis. If you take this symptom as a characteristic, you will end up giving Rustox and you will get disappointed, right? So these are the common symptoms. Please remember, we have to find the individualized, characteristic symptom, and this kind of pain is characteristic. The exact location is characteristic in this case. Okay, and when we try to repertorize it, so I repertorize this case from Phatak repertory. Okay, so location, what is the location? I took the rubric muscles belly off from the Phatak repertory. Then second rubric is the kind of pain he is having, shooting, darting, okay, lightning kind of pain. And how is the direction? Going upward from knees to thighs, and in the neck also pain is going upward. So direction is upward. And when I put these three rubrics in the repertory, we got the remedy CIMICIFUGA. Okay, very interesting result we got. So what we know about CIMICIFUGA, because CIMICIFUGA is the only remedy covering the symptom, all three symptoms. So I try to read CIMICIFUGA from the Materia Medica. So if you look, the Phatak's Materia Medica. Okay, so what Phatak says about CIMICIFUGA, the first line, very first line of Phatak, it's very interesting. Okay, listen and read very carefully. The remedy has a wide action on nerves and muscles. So that is why we are getting what kind of pain? Shooting, darting, electric shock like pain. So nerves are also involved, and muscles, action is on muscles. What he writes further, how are the pain? Violent, aching, shooting, right? Shock like, which go upwards or side to side, in the neck. How interesting. Exact symptom we can find in Materia Medica. And belly of the muscles feel bruised, sore, okay, heavy and aching. So you can see the muscles are affected, belly of muscles are affected in CIMICIFUGA, and we know CIMICIFUGA is famous remedy for muscle rheumatism. Okay, if we read further what J.H. Allen says in his book, it is the rheumatic pains in muscle of neck and back, and it becomes stiff, lame, constricted. That is what happens in rheumatoid arthritis, right? Your joint or your arms, your extremities become stiff, you are not able to move, there is pain, lot of pain is there. Rheumatism affecting the bellies of the muscles. And how are the pain? Stitching and cramping kind of pain. Okay. So here we can see what is the individualizing symptom in this patient is the muscles, bellies are affecting. Though he is known case of rheumatoid arthritis, bellies, muscle bellies are affecting, pain is maximum there. So we consider that location and we could find the exact symptom. So I gave him CIMICIFUGA 200 BD for 3 days followed by placebo. He responded beautifully to CIMICIFUGA and slowly his pain reduced. We could taper his anti-inflammatory drug, painkillers, right? So after a few months he was completely free from anti-inflammatory drugs, painkillers, right? Again I took the case, I started one more remedy after the CIMICIFUGA, the next constitutional remedy, and he was better after that. So this was the, what you can say, the breaking point. I got the CIMICIFUGA with the exact picture when he came in that acute agony and pain. So I could manage this. And friends, so these kind of cases you will see day in day out in your homeopathic practice. Joint complaints, rheumatology patients, they will be coming very frequently to the homeopathic practitioner, to you, and you should able to know how to manage these patients. So because of that, because of this demand, we are going to organize a one-day seminar in Pune on 10th December 2023, and we are inviting Dr. Saptarshi Banerjea, a well-known homeopath from Kolkata, and he is known for his cases, his wide experience, his oratory, and he's going to discuss about these kind of difficult cases of joint complaints, drug dependent cases of rheumatoid arthritis, of joint complaints, how to manage these cases, how to taper the doses, what are the local remedies, how to differentiate them. Everything about the joints you are going to learn in that day. So I would urge everybody, don't miss this opportunity, register fast. See you there on 10th December. Thank you.